It's not a plan, it's a PowerPoint. And Amy's plan is even less. It's like a Post-it note, insert plan here. I actually took a look at the plans that are posted. Mayor Buttigieg, there are 4 expenses that families pay, right? Premiums, deductibles, copays, and uncovered medical expenses. Mayor Buttigieg says he will put a cap only on the premiums, and that means families are going to pick up the rest of the cost. We need to get everybody's health care plan out here. Mayor Buttigieg really has a slogan that was thought up by his consultants to paper over a thin version of a plan that would leave millions of people unable to afford their health care. It's not a plan, it's a PowerPoint. Amy, I looked online at your plan. It's 2 paragraphs. Bernie has started very much, has a good start, but instead of expanding and bringing in more people to help, instead his campaign relentlessly attacks everyone who asks a question or tries to fill in details about how to actually make this work. And then his own advisors say, probably won't happen anyway. Look, healthcare is a crisis in this country. My approach to this is we need as much help for as many people as quickly as possible and bring in as many supporters as we can. You can't simply stand here and trash an idea to give health care coverage to everyone without having a realistic plan of your own. And if you're not going to own up to the fact either that you don't have a plan or that your plan is going to leave people without health care coverage, full coverage, then you need to say so.
I'm actually less concerned about the lack of transparency on Sanders' personal health than I am about the lack of transparency on how to pay for his health care plan, since he said that it's impossible to even know how much it's going to cost. And even after raising taxes on everybody making $29,000, there is still a multi-trillion-dollar hole. Matter of fact, if you add up his policies all together, they come to $50 trillion. He's only explained $25 trillion worth of revenue, which means that the hole in there is bigger than the size of the entire economy of the United States. Mayor, the time has come to level with the American people.
All right, let's level, Pete. Under your plan, which is a maintenance continuation of the status quo, can I finish? The average American today is paying $12,000 a year. That's what that family is paying. 20% of a $60,000 income, $12,000 a year. Highest prices in the world for prescription drugs. Just the other day, a major study came out from Yale epidemiologists in Lancet, one of the leading medical publications in the world. What they said, my friends, is Medicare for All will save $450 billion a year. Because we are eliminating the absurdity of thousands of separate plans that require hundreds of billions of dollars of administration. And by the way, ending the $100 billion a year in profiteering from the drug companies and the insurance companies.
Really important.
There are some Democrats who like you a lot, but worry that this plan, Medicare for All, is going to take away private insurance and that it goes too far. Are they right?
No.